You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, sedation dentistry. According to my first guest, he says that there are many people that don't go to the dentist because of their fear or that they're too busy, this type A type. And he says in one afternoon, you get sedated, you wake up, and you have a beautiful smile. With us, we have Dr. Kelly Olsen. Dr. Olsen, welcome back to the program, I should say.
Thanks, Randy. Good to see you again.
So as a general dentist, I guess you're one of the few guys, I guess less than probably 10% of all general dentists do sedation.
Yes, I would think it's even less than that. It might
Okay.
be closer to 5.
All right.
So
tell me about, now who's the typical patient that comes in for sedation dentistry? Is it really just the complete phobics?
no, not at all. There's a large range of people I see. I see children. I've seen 1-year-olds that need the little thing cut, because they're tongue-tied, all the way up to people well into their 90s. So and anywhere in between, wisdom teeth, people that just want to get things done so they don't have to come back for many visits, the people that are scared. So there's not really a typical patient, it's anybody.
Now your office, for people that don't know your office, we've had you on the program talking about dental implants and those kind of things and giving people a fixed set of teeth in one day. With dental implants, are those people always sedated?
Those people, usually they are sedated. They don't want to hear the grinding or feel the pressure. Not all of them are sedated. Look, doing the dental implants is a pretty straightforward procedure. It doesn't take long, and it's not painful to get that done. So they don't have to be, but when you're doing a lot of stuff, a lot of people just don't want to remember it. They want to leave and just have a good sleep.
We should mention, now you lecture and teach dentists all over the country.
Right.
Like, what are your topics?
Usually it's about dental implants. I do some practice management as far as the other dentists, the things they want to know. I've talked about digital x-rays, where the x-rays are on the computer, about same-day crown machines, so different topics.
So now we should mention your office. So you have this concept where you get everything done in one day, and
Right.
you're able to do everything right there, right? I mean, you do extractions, root canals.
Right.
Tell me, like what are the different services you offer?
Well, we offer the full comprehensive dentistry. So that would include fillings and crowns. We see children. We do periodontal work, which means gum disease, orthodontics, braces, laser dentistry.
Like, what do you use the laser for?
We use them for treating fillings. When people have a cavity in their tooth and they have to have it drilled out, then we do a filling.
So just a laser?
But we use the laser instead of the drill, so they don't have to have the drill.
And no noise?
Right, no noise. A little noise to polish the tooth after the filling's in, but not for taking the cavity out. We do that for gum work. When people have gum disease or they're receding gums, to help that stop, we use the laser for that. For root canals, when you clean out the tooth, you can clean it out with the laser.
So the laser what? Kills the bad bacteria?
Kills the bad bacteria, and it cleans the inside of the tooth out so that it seals properly when you do a root canal, so that it lasts a long time. We use the laser for surgery, like when you cut the gum, instead of with a blade, you can use the laser to do that. When you have a cold sore, instead of taking medication, you use the laser, and it puts the laser energy on the cold sore, and it just touches the cold sore, so it goes away faster. And the same with canker sores. That little sore inside your mouth that is really painful, it makes those go away faster. So we use it for so many different things. It's amazing.
So usually, by the way, at dental offices, you go to one guy for the root canal, one person for the dental implants, one person for the cosmetic dentistry. So you do all of that.
I do. I'm wise enough to know when something needs to be referred to a specialist. But most of the things I can take care of. If they need the root canals, if they need implants, if they need wisdom teeth taken out, yes.
Now, we should mention, because you do IV sedation, you do
Right.
other types of, like the pill sedation, nitrous.
We do I do all those, all that.
Now, I was going to bring up that in Utah in particular, we had a conversation where people are very loyal to their dentist. They don't have to leave their friend, the dentist, if they want to be sedated with you.
Right.
You can bounce them back to their dentist.
Right.
Right?
That's right. Yes, I have people that leave and they move to some of California, Colorado, Nevada, and they come back because they're comfortable seeing me. There's people that travel from Elko or other states because of the fact we can do the sedation. They know they're comfortable. They're not afraid anymore. They can just walk in and know that I can take care of them and they can be comfortable. So yes, people do. They feel loyal to their dentist. I see several people that maybe their tooth won't go numb, and so they need a little extra help so they don't remember getting the work done. Or they come and take care of just certain things where they need to be sedated, and then they go back to their dentist who they have a relationship with, and that's totally fine.
What are the categories of these sedation patients? Is it just really just the phobics?
No, it's not just the phobics. There's people that their life is crazy busy, and so they don't want to spend 3, 4, 5, 10 visits at the dentist. They want to get it all done in one visit if possible. That's a very common person that I see in my office. We can do the fillings and the crowns and the root canals, everything the same day. They miss one day of work, and the next day they're ready to go back to work.
So you have a machine that actually makes a crown right there?
Right, we make it the same day. In fact, there was a gentleman that I'll show you a picture of. I brought some pictures.
All right.
And he wanted to get his teeth done. He had 10 crowns that needed to be done that he'd been waiting for a while and just been putting it off. Was leaving, wanted to see me because he was moving to Oregon. Wanted to get them all done the same day. So he came in the morning. We were able to do all of his teeth, put the crowns on. He had them all finished the same day. And he left, and the next day he came in and said, my bite feels great. It feels like nothing's been done. Because he was able to be sedated, not have to be there for so long. And
is sedation safe, by the way? Like IV sedation, statistically?
Extremely safe. The reason it's so safe is because we don't have to put that tube down your throat and have a machine breathing for you. The person is awake enough that I can speak with them.
Oh, okay.
But they're asleep enough they don't remember. So it's really safe because they're breathing on their own, and I have them on a monitor, and if they start relaxing too much, I just say, hey, wake
So their
up.
blood pressure's monitored, everything's monitored?
Everything's monitored, so it's extremely safe. The key is they're breathing on their own. That's where you get into problems, is with the breathing. So they're breathing on their own. I know they're safe, and they don't care because they don't remember. They don't want to remember the visit.
So you brought some photos. What are we looking at?
I did. The important thing to know about these photos is the story that goes with it. These are people that a good number of them wouldn't have beautiful smiles. They wouldn't have just the dental work needed to be done. It's not all about the smiles. It's about being able to chew and eat. Do they want to eat an apple and not have pain? To eat beef jerky and not have pain? They want to eat the things they want to eat. So whether they have a great smile or not when they're done, a lot of it is just to get the dental work they've done that they need to have because they're afraid. There was a study done that I read. The study said there were about 26 million people in the country that said they would not get dental work done because they were afraid. So I'm not going to do it at all. So they followed up with that question and said, well, what if we offered general anesthesia or IV sedation? Then would you get it done? Of those 26 million, 21 million said yes, they would. So there's 5 million people, doesn't matter.
So this is a big problem then.
Oh yeah, I mean this is a huge number. So there's 21 million people in the country that only a guy like myself can see because they're so afraid. But they'll get it done if they do it under these circumstances. So let me show you some of those.
All right.
This is Nancy, great lady. And you look at her teeth, she was so afraid to come in because she just had bad experiences and wanted to be able not to remember anything. So she comes in, and we just give a little sedation, and I do it in many of my patients are surprised at how good I am at doing it because I do so much. Well, gosh, the nurse couldn't even get it in the hospital.
Well, because I guess dentists are used to working in little tiny places.
So they go on the outs,
right?
They're fine inside the mouth, but you go outside the body and they're nervous. And they're not. It's just a simple, just straightforward sedation. And once she can do that, she's so much more comfortable now and willing to get the work done. So she travels down from Salt Lake when she needs work done because she knows that I can treat her with sedation. Let me show you what she looks like now because of the fact that she could come in.
Nice.
Amazing difference. So this is a person that would have taken anywhere from 5 to 10 visits, at least, to get things she needed done. We were able to do this in 2 visits.
All right.
One to prepare everything, one to put everything on. Both with sedation, both mild, and she's got a wonderful result. And now she's comfortable coming to the dentist. So the fear of coming in is what kept her from having this great smile. You look at her now and her smile, we asked her to smile before. And this is a happy person.
She looks much better in the after.
Well, she doesn't. We haven't really touched anything up. We haven't. It's just she has so much more confidence. She's happy to show her teeth. She's happy to smile. She feels better about things now. It was a life changer for her. And she knows she can come somewhere, regardless of where she lives, and get dental work done when she needs. My mother-in-law,
All right.
I want to show you a picture of my mother-in-law here. So my mother-in-law, she wasn't sure what to do. Her teeth needed a lot of help. She was struggling throughout life. Took immaculate care of her teeth, by the way. I mean, you look at her smile and you wonder. I mean, people judge people because of their smile. That's just what people do. She took better care of her teeth than anybody that I know. And so she was worried about the sedation. She wasn't sure if it was safe. We had this discussion. Once we sedated her, she wouldn't do it any other way. Every time she came in, she put her arm out and said, great, do what you need to. We've done implants, we did crowns, root canals, whatever needed to be done. She was happy with it. But let me show you what she looks like after it was done. Now, here's the great thing, Randy. This picture, the before picture, was taken 14 years before this after picture. So these are crowns I put on 14 years ago that looks like the day I did them. And look how young she looks. She doesn't look like a lady that's 14 years older in the after. Amazing, because she just takes, this is someone that takes great care of their teeth, comes in religiously, life-changing. So you look at her smile, this is an age-appropriate smile.
On the before.
Right, on the before. This is an age-appropriate smile. This is what teeth look like when you've used them for decades, right?
Okay.
This is a normal thing. So then you look at the after, and just giving her a younger looking smile was amazing to see just come out. I mean, it's just, and remember, this is 14 years later. Look how young she looks because she's got confidence to smile and she doesn't have any fear of letting people see her teeth. And so she's more willing to talk and be outgoing. It's just a wonderful experience when you can make someone, give them something that makes them feel younger.
So are those veneers? Are they kind of a combination of things going on there?
No, these are crowns and implants.
Okay.
So you look at that, you'd never know which were crowns or implants, but she has a combination, but just taking the key things in a smile so the smile follows your lip line. We do gum work with laser when we do that to make sure everything looks beautiful. When we do smiles, I see so many people come in with smiles. I'll show you a picture here in a minute. But a lady that has, the gums weren't followed. And
like uneven gums.
Right, uneven gums. Okay. So maybe that's a good time to talk about it now.
Okay.
Let me show you this.
You have a stack of photos. We'll try to get to as many of those.
I've got
it's like you're showing me baby pictures here. I mean, you're proud of these in a way.
I am so excited about this because we're changing people's lives. I get to help people change their lives.
So sedation
part of that
is for the people that are too busy, right? Maybe she has 4 kids, 5 kids.
Right,
run around.
Absolutely.
The guy supposedly is busy.
Yeah, they can take one day and get somebody to help them one day and get all their work done so they don't have to take 4 or 5 days and make this 3-4 month process. So people really appreciate the fact they can do that. But this lady, this is a great picture because you look at her smile, and she went to Salt Lake and she spent a lot of money to get cosmetic dentistry done. So when I look at this, when I met her, I asked her if she'd thought about cosmetic dentistry. She said, well, a year and a half ago, I went to Salt Lake and had cosmetic dentistry done. This is so important because this is an artist's version of what her smile could look like. This is after her work was done.
Okay.
Okay. Now, I want you to look. I'll show you the after. The difference is this is one artist's version of what her smile could look like. This is my version of what her smile could look like. And she wanted beautiful teeth. She wanted them white. But some of the key elements you look at on these photos is you look at her gum line, where her teeth are with the top lip. Mm-hmm. When you smile, you should see your lip following the teeth. And if too much gum is showing, it's not as pleasing, it's not as aesthetic. The bottom teeth should be following that lower lip. And if you look at her picture, you can see now her bottom teeth are resting on her lower lip. Look what a difference it makes. Just one artist's version, another artist's version. So they gave her an aged smile, Randy. Look at the before. I want to point out some things that I'm trained to look at to know what makes a smile look aged. The teeth are flat. When you're older, you've worn your teeth down.
So the bottom of the teeth are flat.
The bottom of the teeth are flat, and they're pretty even. All those front teeth are even. And when she smiles, you see the gum there on the side teeth, and they just look flat.
All right.
And it's a flat smile. When you look at the after picture, they're more oval shaped. They're more rounded. A feminine smile is more rounded.
Whoa, yeah.
It's just softer to look at. It's pleasing. It's pleasing. It's not flat. It looks youthful. So much more youthful. And I mean, it's amazing what a difference in two different
So
arts
it's because, so how much is art, how much is science? That means when we're talking about sedation dentistry today, don't let your fear of the dentist keep you from having the smile you've always wanted. Or if you claim you're too busy, you could have like 2 years worth of dentistry done in one afternoon. But how much is art, how much is science when making a smile look good, in your opinion?
I think by far the majority of it is art. Because when it comes to science, look, most dentists go to dental school, they're trained to put on a crown and seal the margins. And I respect the fact that most can do that and do that well. They can get it sealed. Okay? That's a crown. That's you put on a crown. It doesn't matter what it looks like. You can put on a crown and seal it. That's the science of it. But how do you make it look after it's on? We can get it sealed, but now, do we want to make it more rounded? Do we want to make it flatter here and rounded on the corners, or make it longer or shorter? It should be 75% versus a certain, there's all these things that people don't care to hear about. They just want to look beautiful. They want it to look good.
Okay.
Let me show you a couple other ones. So look at this gentleman here. You can see he had a lot of different things that needed to be done from his smile. And this was his smile. We asked him to smile. He's just kind of showing us his teeth. So he wanted to be able to chew and eat. He did not want to have dentures. So we did a combination of implants and crowns. He wanted to be able to have it done efficiently because he doesn't live in St. George. He lives somewhere else, but we let him know we can do it all efficiently, do it with sedation, so he can have it all done in one afternoon and come back in a couple days and get it finished. And this is what he looks like now. So he gets finished, he wakes up, he's got teeth on that are permanent, that stay in, and we've got little mirrors there when they look out. He leaves with beautiful teeth, leaves looking much better than he walked in the door with. With the sedation, he doesn't remember anything, and he's excited to be able to leave with a beautiful set of teeth that he thought he was there half hour
when they're
ago.
doing IV sedation, oral sedation, or whatever, it must be easier for you to work on them as well, right? They're just relaxed.
Yes, let me tell you something. That's a great question. When you're sedated, people ask me, well, should I be sedated, shouldn't I? And the recovery time is actually better if they're sedated. Because if you can imagine, when you're sitting there with your mouth open, if you're there for a few hours, the muscles get tight. I mean, if you hold something for a long time, it doesn't take long for your muscles to wear. Your mouth's the same. So when they're there, they're completely relaxed because they're sedated. And so we have a little mouth prop in so their mouth stays open, their mouths are relaxed. So the next day, they actually feel a lot better. The recovery time is much faster. And I also don't have to be in their mouth as long. So it's much better.
Now, I've never been IV sedated. My father recently had dental implants and was sedated. And he was so worried about the sedation. And he said, that's the only way to go. So now, even when he goes in to get them cleaned, he wants to be sedated. They go, no, we don't think you need to go that far.
Yeah, let me show you Nate here. This is a gentleman that he said he needed about 17 teeth done to get him looking back to normal. Okay, just because they're so worn. I asked him if he wanted to be sedated, so we did his bottom teeth. He said, no, I don't want to do it. I'm okay. So we did him, and he said he didn't have any pain, but it was a long day. So the top, when we did the top ones, we did the sedation. He said, let's try it with the sedation. So when we did the sedation, after he was finished, he said, you know what? Neither way hurt, but oh my gosh, I would do the sedation every time because it was like no time passed. I was so much more comfortable recovering afterwards, much better. And this is what he looks like now.
Very nice.
Just wonderful picture. This gentleman is the one I talked about earlier, where he had the 10 teeth that needed to be finished up that we did the same day so we could move to Oregon. So he was sedated because he was there to get 10 teeth done. He wanted to be as comfortable as possible. So we did the sedation, and his recovery time the next day, he said everything felt great. He didn't hardly know anything was done. So we have the two of them together. Both of them did the sedation so they could get the work done because their time, they were leaving in a week to go back to Oregon.
So this avoids like multiple times the dentist because this may take a couple of hours. And it's hard to be in the dental chair for a couple of hours.
Well, a couple of hours, right. And he was there for longer that day, but he was sedated. So even though he was there for probably
like
5-6 hours, for him it seemed like a half hour.
Okay.
And they were leaving in a week, so we were able to get both of those done. We had her in 2 visits. She got a whole set of teeth done. So this is another lady that just simply wanted to have a more beautiful smile. She wasn't too nervous. She just asked me what would be the most comfortable for her. I said, look, the sedation, we have a lot of discussion. For people that aren't afraid, your recovery time is going to be a lot better afterwards. So she said, great, let's do that then. And so here's her after, and her temporaries looked a lot better too. This was 2 visits because we have the preparation phase, and amazing the results she had. Very comfortable. Didn't remember having the work done.
So
there.
the people that do this, they say, this is the only way to go. I mean, they're sold on it after.
Yeah, I can't tell you how many people come in that just put their arm out once we've done it because they don't have to be afraid anymore. If they have any significant work done, they want to do the sedation.
And is it true? So with IV sedation, right, that you could pull them out of it right away? That means if they're out of it, there's medication to pull them out of it.
There is, yes. I have a reversal agent that we're all required. If you're trained to do sedation, you have to have a reversal agent. So if their respirations are going too low, we just simply give them the drug that pulls them out of it. Right.
That's nice. So that's better than the pill.
Oh,
then.
it's great. If you have the pill, you don't have the reversal agent. You're calling the ambulance if somebody has a problem.
Okay. Good.
This is a gentleman that his teeth were not bad. But
yeah, they look good. They
weren't bad. He wanted a beautiful smile. And so we talked about different things. So we did the sedation simply just to be more comfortable. And look at the after.
Wow.
This is Dylan. Dylan just came in recently, just for a follow-up. And he told me, it's almost annoying how many people tell me he has a beautiful smile. He says, they tell me all the time. It's like, oh my gosh, yes, I do. So obviously he loves having the smile, but the point is how many people tell him? Because he's got the perfect teeth. His expectations were high, but his teeth were in such a great position, I could give him
So just
the
that little
result.
gap.
Just the little gaps. And here's the great thing. I didn't have to cut his teeth down at all. It was very conservative. We did the sedation for some other things so I could work on his gums a little bit and just turned out beautiful. Just wonderful thing. So when you look at his before, you see how his teeth are a little smaller, little spaces. They're too small for his face. So we just
like kids' teeth.
Right, like
kid.
kids' teeth. Exactly. They're like kids' teeth. So we give him now the perfect smile for his face. And each smile, it depends on what your face shape's like.
All right.
Okay? So this is another gentleman that waited a long time to get his teeth done just because of things going on and time to get it done, and sedated him so that we could get it all done in 2 visits.
Okay.
And here's his teeth. Most places would take several visits, 5, 7, 8 visits to get this done.
Because taking off work and having to make excuses to your boss and this and that, obviously, if given an opportunity to get it done in one day.
Right. Exactly. Another lady that came in and she wanted to get it all done as quickly as possible. And it's not a matter of just being quick. It's a matter of they don't want to spend time in the dental chair. They don't want to come back for a whole bunch of visits. And she also wanted to do the sedation. I don't want to sedate him more than I need to. So we get a lot of
beautiful
stuff in one
smile,
visit.
by the way.
Yeah, look how
what a
nicely hers
difference.
turned out. We did dental implants, we did crowns, root canals, a whole bunch of different procedures.
Now, for people just tuning in, we should mention that you have this concept where you do everything right there. You do your own root canals. You even have a machine that makes crowns right there.
Right.
While they wait.
Exactly. So we can do the crowns, the root canals, the implants, whatever, and then actually make them the same day.
So we have about a minute and a half left.
Can I just show you a few more?
Sure.
I want to show you these.
I don't want to rush you, but yes.
No, this is great. This is my dad. One of the biggest dental phobic patients you know. 17 years it took him to come in. And look at his after. We did all his work, implants, the fixed denture that never comes out. Actually, his was a snap-in denture. And with him, it was we put the implants in and made the teeth in 3 days. He's done. 3 days, he's finished. Okay?
Nice.
This gentleman,
And by the way, he loved the sedation part of it?
oh yeah, well yeah, that's why he didn't come in the first place, because he was afraid. And then the only reason he came in, even after 17 years, because he knew he was going to be sedated.
Did he say, look, if he waited, you worked on him for 17 years, tried to get him in. Did he say, why weren't you pushier with me, or why didn't you talk me into this earlier?
No, because he didn't want to come in. He was too afraid. His teeth finally got bad enough he couldn't eat anything.
But then he said that it's easy. I should have done this before.
Oh, of course.
Okay.
Yep, and that's what most people say. When they get done, they wish they would have done it long before.
Okay.
So this gentleman, teeth were ground down so much, he wouldn't come in unless he was sedated. One of those people that just wanted to be sedated. And when you look at his after, this is a guy that took great care of his teeth, but they were worn so badly. And now he looks like a guy that you'd hire for a job. I mean, honestly, you go in for
looks
a job.
Looks like a little
interview.
kid in the before and in the after. He looks like a CEO of a company.
Honestly, people don't like the fact that they're being judged, but they're being judged. Maybe unfairly, but they are. Look at this gentleman.
And I know you're an actor, right?
Right.
You act in local plays, things like
Love
that.
it. It's a lot of fun.
And we were talking on the phone, when they want to make a villain, a bad guy, they mess up their teeth.
Right. I have bad teeth. I use Invisalign rolls.
Oh, really?
Yeah, of course. I put them in. Yeah, exactly. Bad teeth. You don't have as much credibility.
Okay.
So you look at this gentleman. I mean, this is a great guy, but his teeth. You look at him, and people are going to judge him. But look at the way his teeth look. So he comes in. We sedate him. He wakes up. He's got a great set of teeth. And look at these teeth. This picture we took, like, it was 6 weeks or so after we finished. He just stopped by because he wanted to say, you know what? I want to thank you for what you did for me. Well, that was beautiful.
Do you get a lot of referrals from sedation? Like, hey, you got to go see Doctor.
We do.
You know, really?
This had a lady come in because she didn't want to go to a bunch of different people to get all this work done. And then her friend came in and her friend came in because they do. They like having it all done in one place. Let me show you the final. This is the finale.
We have about literally a minute left.
Okay, this is the finale. Look at this picture. This is Kevin. This is him when we asked him to smile. Okay, he would not get dental work done, period, because he was so afraid. And I'd seen his sister, and we sedated her, and she was just like him, didn't want to come in, but once we could sedate her, she came in. She said, hey, told her brother, come in, and he travels a couple 100 miles to get this done. So, and then we finally got him to smile. So there's him smiling. Mm-hmm. Then we sedated him, did implants, took his teeth out, took care of everything that needed to be done. And he has his beard here because he wanted to hide his teeth. He was worried about the way his teeth looked, like anybody is. I don't care what age they are. They're worried about how they look. So now I want you to see Kevin now. Amazing, the transformation. You would not know this is the same person.
You wouldn't.
I mean, Kevin, very unfairly, people would judge him that he didn't take care of himself, I mean, you name whatever judgment you want. But now, I mean, he's excited now to show his teeth. He doesn't care because he's got a great smile. So sedation can help change people's lives. So
why are more people doing this? I mean, is it, because my assumption is everybody knows that dentists do sedation, or some of them do. I mean, for some of them, is it news to them that they can get sedated?
Well, the thing is, it requires more training. I mean, that's most dental schools.
So look for a dentist. You could call them. Do they have sedation training?
Right. Most just don't. It's a long process to get the training.
Like 95% don't.
I would say that's probably fair. Yeah, general dentists, most specialists do, but the dentists, which is what most people need, right? They need the general dentistry to get the fillings done.
So it might be less expensive to go to you over a specialist to get some basic stuff done because you do sedation.
Right. Okay. Yeah, the fact that we can just do it all there, they have. Think about the time. The time that people have to give up to get it done in so many visits is worth so much more to get it done. Regardless of if it's a few $100s or a little bit more, even if I did it. The time they're saving is by far worth more if they can get it done all in one visit.
Good. We're out of time. So don't let your fear of the dentist keep you from having the smile you've always wanted. I want to thank you for coming to the show. You say if they mention the Wellness Hour or that they saw you on TV, that on the Wellness Hour, that you will give them a free consultation.
That's right.
Is that right? Mm-hmm. Okay, good. I want to thank you for coming to the show. Great stuff. You've been watching the Wellness Hour. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.